So, Dr. Brian, I'd love to get your input based on the research that you and the team are doing at Mizzou. What does the evidence show us at this point about efficacy and safety, and how does this compare to the current standard of care?
Yeah, it's a great question. The short answer is I can't tell you the difference between this and standard of care because I have never seen a comparison head to head. What I can tell you is that in our study, we enrolled 14 dogs contemporaneously with the COTC 21, 22, and 26 trials. At the time that we completed the ELIAS study, we had 14 dogs on study, and 5 of them were long-term survivors, greater than 2 years. At the same time, we had 30 dogs on the COTC studies, and there were 3 long-term survivors, not quite at 2 years actually, but we agreed to call them long-term survivors. And on a Fisher's exact test, that was statistically significantly different as far as proportions. So at least in a contemporaneously enrolled group of dogs, not randomized, client selected, but really the enrollment criteria were not substantially different. The main difference in enrollment criteria were that the COTC trial required that we do an abdominal ultrasound, which I do not standardly practice for staging my osteosarcomas. And our study with ELIAS required they have a bone scan, which the COTC trial did not. We did eliminate 1 dog based on contemporaneous osteos, METs at least, or a metachronous primary. I don't know which it was from the ELIAS trial, and none of the COTC dogs died of early bone mets. So I do believe these were relatively identical groups of dogs. I don't think there was anything pre-selecting for the ELIAS dogs that should have made them live that long. So with a median survival of 415 days, which was quite remarkable given that the median disease-free interval was only 285 days in that study. These dogs lived with mets without further therapy other than honestly pred sometimes just to settle them down because they weren't feeling great with their mets, a surprisingly long time, longer than we expected. You know, the usual, this is why it works, because they went longer than we expected. But I mean, that's a big gap between disease-free interval and survival in exactly the same 14 dogs. Nobody's censored, nobody disappeared. We know exactly what happened to all of them. And the fact that 5 of them hit the 2-year mark, I don't have any other way. I don't have 5 other dogs that I've treated for osteosarcoma in the last 10 years that hit the two-year mark, even though we've treated a ton of dogs with osteosarcoma. So I really think that there is strong evidence that the ELIAS procedure benefited these dogs substantially and on average based on that median survival. I will also point out that every single piece of the ELIAS immunotherapy process is extremely well supported in the scientific literature across multiple species. There is no piece of it that is a leap of faith that has never been shown to be effective in experimental animals or frankly in human studies and in some dog studies as well. So the combination of all of those things appears to be more effective than any of the pieces that have ever been published. And you know, there's certainly evidence that it's not less effective than amputation and carboplatin chemotherapy in a group of dogs from the same period of time, all studied very thoroughly in prospective enrolled trials.